Welcome back to News 46. From alcohol to cocaine to pain pills, tens of millions of Americans deal with addiction every day. It costs the United States $600 billion a year in lost productivity, crime, and health care. So what happens when healthcare providers become addicts? CÉLINE McArthur has the story.
This health tip is brought to you by Humana.
Visit our local office in the Pahrump Valley Junction Shopping Center or call 775-727-0871.
It's the focus of shows like Nurse Jackie and House MD.
I need help.
Both are examples of art imitating life. Dr. Mark MYER heads a healthcare professionals addiction program. Every year, 250 doctors and nurses from around the U.S. come here for help. He says 1 in 10 doctors will face addiction at some point in their lives. Alcohol is the #1 drug of choice. After that,
the other substances of choice are different, and that mainly has to do with access.
MYER tells us healthcare professionals' consumption rate of opioids like Valium and oxycodone is 5 times greater than the general population. Sometimes they even divert medications from patients.
The medication or drug is kept for personal use.
Doctors and nurses who do seek help
notoriously have a very difficult time taking on the patient role. We work very hard on getting people to face their guilt and shame and to realize that they can recover.
MYER says the sobriety rate after treatment for the general population is 50%. For healthcare professionals,
the 3 to 5 year abstinence rates are as high as 90%.
MYER believes that's because if they don't get better, they could lose their medical license. But many do return to patient care. Dr. MYER knows this firsthand. Before he ran the program,
I went through the treatment program here. I'm a recovering opiate addict myself.
He's been clean for 4 years. Now his patients are his peers. I'm CÉLINE McArthur reporting.
MYER says addicted doctors and nurses in recovery may face some new circumstances at work after treatment. For instance, they might have restrictions on what hours they work and limited or no access to controlled substances. MYER tells us because the success rate among recovering healthcare professionals is so high, experts are trying to figure out what elements of the program can be applied to treatments for the general population.